And so we cross over to Nakuru County, where a looming health crisis is in the offing if the county government fails to resolve a stalemate with doctors of a NANA CBA implementation. The KMPDU South Rift branch has already issued a 21 strike notice. I'd like us to cross over live to my colleague Joanda Tin, who's going to be speaking to KMPDU official Rift Valley branch, just to tell us why a strike notice at this time when the country is fighting COVID-19. Joanda Tin, good morning. Over to you.
Well, a very good morning to you, Brenda, from here in Nakuru County. Well, as I say, the situation might be really bad. Remember, COVID-19 cases continue to rise, especially here in Nakuru. And the many people who have been affected by COVID-19 will need a lot of care from the doctors as well as the nurses. But as you say, they have already issued a 21-day strike to the county government of Nakuru. But allow me now to go straight to the person who is in charge so that he can tell us exactly what the problem is. Thank you, sir, for joining us. Let's start with your names and then tell us what are the issues that you are raising.
Thank you so much, Johan. My name is Dr. Davji Atela, the South Rift Branch Secretary for KMPDU. We have given Nakuru County Government a 21-day strike notice, which is dated 11th, and they received it on 14th. So we expect the strike to commence on 4th of September 2020. The reason why we gave the strike is majorly because of the CBA, an implementation of the CBA, which actually is a very important element to be used during this particular time of COVID. Number one, there's a big shortage of doctors in Nakuru County. It's something that we had really been discussing along. There's issue of contract employment. Then there's an issue of promotion of doctors, which has been delayed for over 10 years. On Monday this week, we had a consultative forum with the governor and the county government Department of Health, and we actually explained to them explicitly that we need to have the consultant as specialists who are working in the COVID units and who are working in the facilities in the county, placed in the right job group as per the CBA. Then we also explained to them the need to have the doctors who are on contract covered and be in the front line, get protected while they offer the services. We also explained to them explicitly why we need to have more doctors hired. But then we are in agreement over the issue of over the issue of promotions, because then they gave us that by next week they will give letters to all the doctors who deserve the rightful job groups. And then on the issue of contract employment, they're a bit hesitant on it. So we're actually looking at a way to look for other legal ways to ensure this particular thing is done, because then these doctors will be suffering. So essentially, after the meeting of Monday, which was just a consultative, the strike notice that we gave is still on, and we expect that if the things that we demanded are not really handled by 4th of September, then all the medical officers, all the pharmacists, all the dentists, and all the specialists in these particular categories will not be able to be reporting their duties.
In your notice, you mentioned that there are some doctors who would like to go for postgraduate lessons, and they have been denied that chance. Why is that?
Generally, you see, counties need to always invest in their people. So when doctors are put in contract terms, these doctors did not have any future of career progression. So that's why we're putting it such that when the county needs to employ doctors on PNP, so that there's always more specialties that are coming to the county. Yes.
Let's speak about the impact of this pending strike to the fight against COVID-19. What do you think would be the impact?
You know, the fact that we gave this strike notice, we gave it an humble time. We didn't give a 7-day strike notice like the one we did earlier on the period. So then it was to give the county an humble time to implement these issues. And if you can check back, we've had about 13 meetings with the county government. We've had a series of letters to the county regarding these things, and they have not been implemented. So then it was just forcing us at this point to give them the notice. And moreover, some things like shortage of doctors is going to benefit the Wananchi, and is going to benefit the Nakuru County residents. And also having a workforce of specialists and doctors and other doctors who have been put in the right job group as per the CBA is going to make Nakuru County to have a workforce that actually is energized to do their job.
If you were to speak directly to the person in charge, what would you tell them?
I will just ensure that the governor is actually a very understanding man. Therefore, it should just ensure that the Department of Health implements the promises that he gave to doctors as per the last meeting of Monday. And then we also ask him to soften his heart on the issue of contract employment, because these doctors actually are disadvantaged and discriminated upon in this process. So then if he can look into these particular issues, we're actually very glad that these particular strikes will actually be averted, and more, it will benefit more of the Nakuru government, Nakuru residents than anything.
Thank you.
Yes.
Well, Brenda, that is the situation here in Nakuru County. As you said, the impact of COVID-19 has been felt, especially in the health sector, and they are calling on the county